In a joint press briefing, health unions and societies that included the Kenya Union of Clinical Officers, Kenya National Union of Nurses, Kenya National Union of Medical Laboratories Officers, and the Kenya Health Professional Society now want equity and additional risk allowances. According to them, frontline health workers are facing high risk of contracting the COVID-19 as they work to save lives.
Kama tunaangalia health risk allowance, kuna vitu tatu lazima ifuate. Lazima ifuate ile muda unachukua na mgonjwa. Kama wewe unaweza kujua shida yako nayo ama ile knowledge ya ile shida yako nayo akija na environment ambayo unafanyia. Tukiweza kuangalia hizi vigezo tatu, tumeona ya kwamba ambao wanapewa ile kubwa zaidi wako nambari 4 kwa laini. Walio pale mbele wanapewa 3,000. That is a sixth of what is being given.
Within 7 days, if we are not going to be engaged by the government, we will engage them in the road they know. We will come here, we shall announce a major industrial action that they have never seen before.
The union leaders also lamented being sidelined in the planning of COVID-19 mitigation measures, leaving them unaware of plans by the government in protecting and motivating their members.
Lazima tuhusishwe kwa sababu sisi ndio tuko na ujumbe wa watu wetu kutoka mashinani na ndio tunatakiwa kuwapatia information. Wasipotuhusisha wanakaa kwa table. You cannot manage in the boardroom. Case management yote inafanywa kwa boardroom. Kila kitu, ndio maana tunadanganywa. Kila siku mmemsikia waziri wa afya akisema wameweza kutrain health workers. Na sisi tunasema hamna. Tumeweza kufanya survey zaidi ya 3 Infotrack, Kellen, na sisi kama viongozi pia tumeweza kufanya yetu. Zote zinasema 93% of the health workers have never been trained.
We are not being involved at this point in time because we should own the process, because we are exposed to the risk in income measures. There's no difference in terms of exposure to the risk factors in this particular instance, and even beyond the COVID-19.
With law enforcement officers directed to arrest those caught defying the presidential orders to observe the dusk to dawn curfew and placing them under mandatory quarantine, the health workers say a shortage of staff is impacting on their service delivery owing to the rising numbers of persons to look after.
This time of curfew, which have resulted to police robbing and actually mishandling our professionals. We have several of them who have already been arrested and been put for mandatory quarantine, which should not happen, despite even them having a curfew pass. This must stop.
With most of the public service vehicle operators around the country having doubled their fares, citing a directive from the Health Ministry that restrains them from booking over 60% of their capacity, health workers say they have not been spared and now want a logistical support. Joel Chacha, Switch TV, Nairobi.